Pada segmen kali ini, saya akan menjawab. Ijul kecil bertanya berkenaan rawatan tulang belakang dan tanda-tanda penyakit tulang belakang. The function of spine is to provide support to the human body. It is serve an axis to stabilize the human body in terms of balance. Other than that, the spine function is to protect the nerve inside the spine. And also the spine function to provide muscle attachment or limb attachment to the human body. And the next function is for well-being of the human body or for red blood cell production, which is called hematopoiesis process. The other function of spine is for calcium metabolism, which is if it is deranged, it will lead to osteoporosis. In general, the spinal column, or we call vertebral column, can be divided into multiple areas. Upper part, cervical. Second part is thoracic. Lower part, lumbar. And the lowest part is sacrum and coccyx. Cervical spine have 7 vertebrae. Thoracic have 12. Lumbar have 5. Sacrum has 5. And also coccyx have 4 or 5 fused vertebrae. As you can see in front of me, this is a spine model. This is a true imprinted 3D spine model of human anatomy for lumbar area or lower back area. Okay, and I want to show you, this is a vertebra body or bone. The white color is the bone or vertebra body. In between the vertebra body, there is a structure called disc. The disc contains 2 parts, annulus and also nucleus pulposus. The nucleus pulposus contains gelatinous material. It's a soft and delicate structure in our body. It serves as a shock absorber. The annulus is a ligament to reinforce the disc. It is to prevent the occurrence of slip disc. At the back here, there's a joint. At the back of the spine, there's a joint. You can see the joint. This is what we call facet joint. Inflammation of the facet joint can lead to pain also. And there will be a muscle over the back of the spine. This muscle serves as an anchor of the spine to maintain the posture of the patient, what we call paravertebral muscle. And you can see the next structure, which is the yellow color, is the nerve. Any problem with the spine, for example, fracture of the spine and the bone piece goes at the back, it will hit the nerve and the patient will have a pain, shooting pain down to the leg, lead to probably paralysis. Slip disc, you can see at the back here. This is the model of the slip disc. If it is slip out and pressing on the nerve, you will have a condition called sciatica. Okay, next. As you can see, there are so many causes of back pain. It can be muscle pain, spasm of the muscle, or sprain of the muscle. It also can be a slip disc, or the other term called prolapse intervertebral disc. The third cause will be degenerative disc disease. Next, spinal stenosis, or the other term is nerve compressive disorder. And the most sinister problem are, number 1, you have to identify malignancy, fractures, infection, and tuberculosis. How do we differentiate the causes of neck pain and back pain based on the patient complaint? Now, I want to bring the term called red flags. So, normally the doctor will ask history and followed by physical examination. Number 1, why we need to know the red flag sign? Because we can differentiate whether the back pain or the neck pain caused by malignancy, fractures, infection, or tuberculosis. The doctor will ask the patient if he or she has a previous malignancy, for example, lung cancer or breast cancer, and the patient have a neck pain and back pain associated with unexplained weight loss or loss of appetite, recent fever with chills, ragus, if the patient have a diabetes mellitus or immunosuppression status, or with a previous chronic disease, for example, chronic renal failure or autoimmune disease, on steroids, or if the pain occur all the time, especially during nighttime or during the rest, or recently whether the patient have a fall, or if the patient have a problem with urination or bowel dysfunction. Then the doctor will do physical examination. The doctor will assess the power of the lower limb, the sensation of the limbs. They will check the anal tone, or what does it mean? The doctor will put his finger into the patient anus to assess the sensation, perianal sensation, and also to assess the contraction or anal tone, whether there's a laxity. If presence of these red flags, then the doctor may suspect malignancy, fractures, infection, or tuberculosis. What will the doctor do next? The doctor will do investigation, blood investigation to look for the infection parameters, to look for tumor markers, and specific studies related to specific problem. Next, he or she will order X-rays and MRI of the spines to confirm the diagnosis. Again, remember, there are so many types of neck pain and back pain, but you must recognize sinister problem by remember and identifying the red flags of back pain or neck pain. Thank you. Don't forget to like, comment, share, and follow my channel. Please kindly support this channel to propagate the knowledge to other people. And don't forget to ask questions. I will try to answer the questions. Thank you. Hello, good to be back again. There are three main causes of back problem with leg pain. Number one, spinal stenosis, which cause the narrowing of spinal canal and lead to compression of the nerve or neural elements. Number two, disc herniation, which is protrusion of the disc lead to compression of the neural element, whether it is central or lateral, or we call outer part. Number three, annular tear. So, in summary, spinal stenosis, disc herniation, and annular tear will lead to back problem with leg symptoms, which is called sciatica. See you in the next video. Don't forget to like, comment, share, and subscribe this channel to propagate the knowledge. Thank you. A young gentleman with left sciatica and numbness for 2 weeks. Diagnosis L3, L4, left posterolateral disc herniation, huge disc. He successfully underwent left L3, L4 transforaminal endoscopic discectomy. This procedure is done endoscopically. You can see the burr. This is a diamond burr rimming of L4 superior articular process and pedicle. This is important to open the space so that we can remove the disc. This procedure to remove the herniated disc. Can see I have difficulty to remove the disc in one piece, but eventually, finally, I still managed to remove the big disc in one piece. You can see upon removal the disc, you can see the nerve is free, which is floating and moving, or mobile nerve root of L4 traversing nerve root. And the advantage of the surgery is minimally invasive, less bleeding and less pain post-surgery, faster recovery and immediate pain relief, and small wound. Post-operatively, patient is well and no more left sciatica or left shooting pain from the buttock or gluteal to the left foot. Hello, selamat sejahtera kepada semua. Hari ini kita akan bincangkan berkenaan 3 punca utama masalah tulang belakang dengan sakit kaki, atau dalam arti kata lain, sciatica. Pertama, spinal stenosis, di mana keadaan tiub tulang belakang menjadi kecil dan saraf tertekan. Kedua, slip disc, di mana disc akan terkeluar daripada tempat sepatutnya ke belakang, sama ada dekat tengah ataupun sebelah luar, akan menyebabkan sakit kaki. Ini disebabkan oleh saraf telah tertekan. Dan yang ketiga, koyak kawasan annulus ataupun dalam English annular tear. Secara kesimpulannya, spinal stenosis, slip disc, dan koyak bahagian anula ataupun annulus akan menyebabkan sakit belakang dengan sakit kaki, atau dalam arti kata lain, sciatica. Terima kasih. Jangan lupa like, komen, subscribe, dan share supaya ilmu ini kita dapat kongsikan bersama untuk kebaikan bersama. Terima kasih. Hi, good to be back again. Today, I'm going to share regarding disc prolapse or slip disc. As I mentioned in the last video, slip disc can cause leg pain, which is called sciatica. So, how do we treat this prolapse? Before we treat, the doctor will confirm the diagnosis by performing MRI scan. He will assess whether you have a disc bulge, disc protrusion, disc extrusion, and also sequestrated disc. And also, the doctor may look if any evidence of any annular tear. And the treatment will always start with pain management, which is start with oral medication. Oral medication can be divided into a few areas. First one, NSAIDs, which is non-steroidal anti-inflammatory drugs, such as Celebrex, Acoxia, diclofenac. The other medication will be we call neuropathic drugs, such as gabapentin or pregabalin. And some doctors may give you a B complex. In the other terms is nerve vitamins which help the nerve to heal. For example, mecobalamin, neurobion. Again, the doctor will always start with oral analgesia, and they will send you for physiotherapies, which focus on pain management, posture control, and basically to improve your ergonomics. How long this patient will be on non-operative treatment? Most of the doctor will observe you for about 6 weeks to 3 months. If this treatment regime fail, then they may suggest for injection. Injection could be epidural steroid injection or transforamina steroid injection. And the doctor will observe you closely, and if the condition still persists, they may offer you operation, which is decompression and removal of the disc. In medical term, laminotomy and discectomy. What is it? This process involves make a small hole over the spine and then push or retract the neural element or nerve and then remove the disc. The idea is to relieve the compression over the nerve. Traditionally, this operation, there will be a wound. Standard wound should be around 3 cm to 5 cm wound over the back. And as the technology advances, then there will be smaller wound due to the improvement of technique of surgery. Next level of the minimal invasive treatment will be endoscopic spine surgery, which the average wound will be around less than 1 cm wound. It involves placing a instrument guided by endoscopic camera, and then again it still involves make a small hole, which is called laminotomy, and then it's the same procedure with the traditional. After laminotomy, involve retraction of the neural element and then removal of the disc. The advantages of endoscopic surgery: small wound, less bleeding, less trauma or less tissue injury, and then faster rehabilitation. You can see the video. Don't forget to like, comment, share, and subscribe the channel to propagate the good knowledge regarding this problem. Thank you.